Journey to Health is a nutrition education program. It's bilingual and it's free for community members. The Journey to Health program is a collaboration between the University of Utah Center for Community Nutrition, the University of Utah Wellness Bus, and the Utah Food Bank. The Intermountain Foundation provided an extremely generous 3-year grant for us to design and pilot the Journey to Health program. The program is a 6-month program, and participants do 9 activities within those 6 months. It was designed to reduce health disparities and improve nutrition security amongst individuals living in lower income neighborhoods that have higher risk for certain chronic diseases like diabetes and hypertension. Because the Journey to Health program is a collaboration with the Wellness Bus, we are able to offer free health screenings to our participants before and after they participate in our class. They'll do 2 biometric health screens on the Wellness Bus, 4 nutrition education classes, 2 individual health coaching sessions with a dietitian, and then the last thing that we do together is the community meal. Journey to Health cooking demonstrations focus on affordable and culturally relevant recipes that utilize ingredients from traditional Latin American dietary patterns. During the class, we really break it down. How can we make sure that we are still getting all of our nutrients while we're on a budget? So we're gonna do an agua fresca with cucumber and mint and lime. Nowadays, sugar-sweetened beverages are super common, and we can have those as like a treat, but it's good to try to limit those. So we're gonna show you how to make a very tasty, yummy water that will be just as good.
Tener una bebida que todavía tiene sabor, que sabe un poco mejor que solamente agua, ¿no? Pero todavía contiene nada de azúcar y tiene nutrientes también.
My name is Ginger Zamora, and I am the Journey to Health interpreter. One of the biggest obstacles that I've seen that comes with nutrition and different cultures is understanding that you don't have to lose your traditional foods and your traditional food practices to lead a healthy lifestyle, and you're just talking about adding foods, vegetables and fiber and protein to the things that we already love.
After they complete those 4 classes, they then have the chance to meet one-on-one with the registered dietitian from the Wellness Bus, Alex Hernandez. This is their chance to sit down one-on-one with a health professional and make goals that will help them take this information and then put it into practice in their real life.
Participants are encouraged to visit the Wellness Bus for at least 2 health coaching sessions. These include biometric screenings such as checking blood pressure, blood sugar, cholesterol, weight, BMI. And then we typically will talk about what changes can that person make to help improve their health.
Alex nos enseñó que podemos comer pozole, que es un platillo típico de nosotros, los mexicanos, pero con más verdura, aguacate, lechuga, rábanos, y eso nos ayuda más. Y es un platillo nutritivo al final.
Estoy muy agradecida a este programa porque me ha ayudado a poder afectar la salud con mi esposo. Mi esposo tiene también diabetes y este programa ha sido magnífico y se ha sentido muy motivado, así que yo estoy doblemente feliz.
And the last thing that we do together is the community meal, which is a great kind of celebration of our completion of the program together. We have a meal that we cater from Chef Wendy Juarez of Prime Corn. Chef Wendy Juarez is the perfect community partner for Journey to Health. She has been wonderful in not only providing all of the catering for our community meals, but really becoming a true partner.
So today we will be making sopes with chicken tinga. I will also make some pico de gallo, and I will give a little treat to the participants. That treat is made out of popped amaranth and honey. I like that people is enjoying the food because sometimes there's this resistance like, okay, I need to make healthier choices, but I will miss the flavor. And these dishes prove that you don't have to choose either or. It's like, okay, you can eat healthy and enjoy it and feel good about it. It's always good to eat some spicy food because they will drink more water.
for our community meals, it's almost like a focus group. I asked the participants, what were some things that you noticed improved in your health? And then they also give us feedback for additional topics or services they would like the Journey to Health program to offer in the future.
I have been really enjoying talking with the nutritionist at the wellness bus, and I'll probably go see her a few more times. She's like, come on, whenever.
Yeah.
Like, the appointments are available for anybody.
I lowered my cholesterol like substantial amount from borderline to within a healthy range in a pretty short period of time. So I was really happy with that.
We were not sure if such a short 6-month program would produce super meaningful changes in biometrics. However, we were very excited to see statistically significant improvements in BMI, blood pressure, as well as hemoglobin A1C. Preventative health is really important for communities because if you can prevent things like diabetes, if you can prevent things like cardiovascular disease, it's much less expensive to buy fresh fruits and vegetables than it is to have doctor's visits and have to buy expensive medications.
And so for diabetes, for example, if we can keep one person from progressing from pre-diabetic state to a frank diabetic state, we're saving the health systems hundreds of thousands of dollars per case. And so if we can do that across numerous individuals, we're saving millions of dollars a year by providing these fairly low-cost services.
So the success of the Journey to Health program is due to so many things, not just an evidence-based curriculum, not just the wellness bus, but so many individuals at different community organizations who have come together to make this happen. And it feels good to have community partners who tell their community members, you need to be going to the Journey to Health class.
Without the Journey to Health program, the wellness bus would have a limited reach. We've seen that over time, that as people have come into Journey to Health, that it's not just one person that we're affecting, but we're affecting families.
One of the consistent things has been the people that have been there every week. So getting the familiarity with the folks and the program has made the difference.
That's probably been the biggest public health feat that I've seen in this program, is just the consistency and strong relationships that they've had.
Once we're able to provide preventative health, we're able to provide free services like the wellness bus, like Journey to Health, we're able to give individuals dignity, and we're able to give them that information that they can then use to make healthy choices throughout their lives.